Disorders are very common.
Dr. Patricia Westmoreland with Acute Center for Eating Disorders in Denver often treats those who are very medically ill from eating disorders. Demand for care is high.
We have a 30-bed unit, and there is typically always a waiting list.
Over at ED Care in Denver, Brenda Velacera says they're also seeing a growing need for eating disorder treatment.
There's always been a need, but I think the need for eating disorder treatment has increased exponentially since COVID.
A need that carries dramatic consequences if left unmet.
Eating disorders have the second highest mortality rate of any psychiatric illness other than addiction, opiate addiction.
Come January, a new law takes effect in Colorado to help those caring for people with eating disorders. It will limit the use of body mass index in determining treatment. Dr. Westmoreland says that's important because often it's not necessarily the weight reading on the scale, but the change in weight that needs to be addressed.
Unfortunately, insurance companies in the past and still now try to use body mass index as a way to indicate whether or not somebody needs a certain level of care.
So there's much more that goes into an eating disorder than weight.
This new law will also ban the sale of diet pills to minors without a prescription. Velacera says that's critical to preventing eating disorders from developing.
Not having adolescents access to diet pills, I think, is a great protective factor that our society can give individuals from helping them stay away from or having an eating disorder.
Both Westmoreland and Velacera say the new laws won't bring much change to how their facilities operate. These rules have already been best practices for years. But Velacera says having this written into law is critical to ensuring people can access the care they need, and that all facilities are offering those same best practices.
When people are not necessarily in the eating disorder community, for lack of a better term, where they are thinking that they're being helpful and then they're not following these standards, and that's where it can be a bit dangerous or risky.